A couple of uplifting stories of a community coming together to help a financially struggling senior and a 95-year-old man who inspires his coworkers are just that, inspiring. They do, however, also show the growing economic squeeze on the elderly. For more on this, let's bring in Rick Smith.
And they were this time evidently this church, this Trinity Moravian Church in North Carolina, bought nearly $3.3 million in medical debt for the local residents, people who would didn't have any money, they couldn't pay the bill, so they got this debt hanging over their head, and their credit ratings are being destroyed. Well, they bought up this debt, and you go, wow, where does a small church in North Carolina get all this debt? Well, they paid about $15,000 for it, to tell you what just how much destroys people's lives. Or I guess the right response is how little it is that destroys people's lives. Then this church held what they said was a debt jubilee ceremony, and they burnt up all the debt and canceled all of it. It was a great thing, and it was a celebration, and it was uplifting, and it was all these things. And I'm not taking anything away from that. Good on the good folks at Trinity Moravian Church and places across the country who do this. In this moment, it is something that is desperately needed. But this is where I get a little frustrated with our media. It's all of these stories that, aren't these heartwarming, great, feel-good stories, like the 100-year-old guy who's the greeter at Walmart, because he can't afford his medication, he got to work. There's this where they're taking up collections to pay off people's debts. There's all of these things where you go, these are sadly signs of a system in failure. Now, this is nice. This is nice work, and I am not diminishing what these folks are doing. It's how we view it. The fact that $3.3 million in medical expenses went unpaid, that means the rest of the system absorbed that. That means that your premiums went up, the costs for aspirins went up, the costs for other medical treatments go up because $3.3 million didn't get paid, because we don't have a system that ensures that everyone gets access to care. We just saddle them with a lifetime of debt. Well, this group has figured out how to go and do what the vultures do. Because understand what happens if you don't pay your debts. The hospital just writes it off. It comes off of their taxes. It comes off their net profit, loss, gain, whatever. And then they sell it to a third party for literally pennies, because they know they're getting nothing out of it. They know that they're not going to be able to track down this money. They're mostly poor and working class folks who just don't have it. Because we have a law in this country that says hospitals can't let you die at that moment. They've got to provide you at least enough care to ensure that in that moment you don't die before they push you back out the door, or in the case of the hospitals in Los Angeles, drop you off on Skid Row. So we then have the vultures who, after you've been somewhat taken care of, pushed out the door, run up a huge emergency room bill, then the vultures come in and start harassing you, and constantly harassing. And you go, don't we have a better system? Because here's the thing, you and I can't then go and buy up our medical debt like this RIP medical debt group does, because they act as one of these vultures. Only they buy it and then get rid of it. They don't call and harass and intimidate and do all of those things that we've seen. And the frustrating part of this is our system. And I think we're better than this. I mean, the reality is we have the highest medical expenses of any country in the world, and we have the most expensive healthcare system in the entire world. Yet we don't get the best care. Now, if you're able to pay, if you're fortunate enough to have the resources, yeah, you're going to get reasonable care. But we've got long wait times. We've got negative outcomes. We've got all kinds of stuff where you would think, with the amount of money that we're spending, we'd be a little bit better off. And again, for me, it comes back to the policy stuff. The fact that we're spending the money. $3.3 million in expenses went out. It didn't get paid. The system absorbed it. It raised the costs for everybody else. Had we a system that ensured that point of service gets paid to where we don't have all of this stuff, costs would come down. But we're never going to do that because there's too much money in it.